Let's take a look at the arm region. So the arm region is divided up into 12 zones, 4 in the upper part of the arm, 4 in the forearm, and 4 on the hand. So let's talk about the upper arm first of all. So we use the same way of finding the zones as we do for measuring acupuncture points. In other words, finding the axillary fold. And if you take a horizontal line out through the deltoid from the top of the axillary fold, then that gives you zone 1 from the top of the acromion down to that horizontal line. Once you have that horizontal line from the top of the axillary fold, your next landmark is the cubital crease. And you just divide that area into 3, and that gives you zone 1, zone 2, zone 3, and zone 4. You can imagine them like bracelets coming across the arm. Now, when we're measuring on the forearm, our landmarks are the cubital crease and the transverse crease of the wrist. So once again, we use the same principles for measurement that we do that we use in acupuncture. So we want to divide this arm into 2 halves and then 2 quarters, and that will give us zone 5, zone 6, zone 7, and zone 8. Okay, so we've done zones 1, 2, 3, 4, 5, 6, 7, 8. Now we need to do 9 to 12. So on the hand, we need to recall several landmarks. The first is the wrist joint itself, the transverse crease of the wrist on the dorsal surface. The second is the metacarpophalangeal joint, or the knuckles here. And the third is the proximal interphalangeal joint. So to find zones 9 and 10, we simply divide this distance in half. So from here to here, we get approximately zone 9 is here and zone 10 is here. Zone 11 comes between this landmark and the interphalangeal joints. And zone 12, reproductive zone, is here on the fingertips and the distal joints. So on the thumb, we have large intestine 5 here, and we have the metacarpophalangeal joint. So we simply divide this line in half to give us zone 9 and zone 10 on this side. And then zone 11 is on this segment, and zone 12 is the distal segment of the thumb. So that gives us the whole 4 sections on the hand. Another way to think of this is to take 2 famous acupuncture points, large intestine 3 and small intestine 3, and they create a horizontal line through the dorsal surface of the hand. If you rotate the hand, you also have that same horizontal line, and that is the dividing line between zones 10 and between zones 11. And then once again, you divide this distance from the transverse crease of the wrist on the anterior side to the line between small intestine 3 and large intestine 3. And that gives you your zone 9 and your zone 10. And then zone 12 is here, coming to the distal segments of the fingers.